Hi, I'm Max Baker-Hytch. I'm a lecturer in philosophy at Wycliffe Hall, Oxford University, and I did my PhD in philosophy looking at questions to do with the nature of evidence, especially in relation to religious belief.
Hi, I'm Sharon Dirckx. I'm a speaker, author and broadcaster. I come from a background in neuroscience. I have a PhD in brain imaging from the University of Cambridge.
We're going to be talking about a topic that is, I think, very fascinating, particularly given the long-standing interest that I think humans have always had in things that don't seem to quite fit into a materialist view of reality where everything ultimately is physical matter at bottom. And that is the phenomenon of near-death experiences. And this is something we're both interested in, you, Sharon, as someone with a background in brain science. So why is it that you think near-death experiences are so interesting?
Well, I think that near-death experiences are suggesting that the death of the brain is not the end of the person, if indeed they're authentic. You know, we live in a world where we presume that matter is all that there is. That is the presumed backdrop to the sciences, but many who aren't in the sciences also live with that view of the world. If you can't see and touch something, then it's not real. But what we're seeing in near-death experiences is people in a state of clinical death who are reporting vivid, lucid consciousness. So how do we make sense of that? And this is an instance of something that has kind of spiritual, philosophical relevance that's being recorded in a scientific context. And for that reason, it's particularly interesting.
Yeah, that is quite striking, isn't it? So presumably, reports of near-death experiences are not necessarily something you would expect to find in ancient history where people weren't getting resuscitated very often. Is it the case that this is something that's been discovered fairly recently? Yes,
it is a recent phenomenon. With the arrival of resuscitation techniques, we have instances of patients that have been declared dead on the operating table and yet have been able to be resuscitated and have reported being conscious. The first known instance is of a medical student called George Richie, who in 1943 developed a double pneumonia. And in that day there weren't antibiotics, and so he ended up dying of this on the operating table, and the resident nurse was so upset by this they managed to persuade the doctor to inject adrenaline close to his heart, and George Richie actually revived. At that point he had been dead for 9 minutes, and he recounted an extremely vivid conscious experience that happened to him. He later went to write about this in a book called Return After Tomorrow, which came out I think in 1978. When he himself qualified as a medical doctor, he started to tell his medical students about his own experience. One of those was Raymond Moody, and he went on to be the first to systematically look at this. I think he studied about 150 people, and he wrote about it in his book Life After Life, which has sold millions of copies. He was the first to coin the term near-death experiences, and so what we have is a kind of one medical professional telling their students, and then in that audience are people who are interested, and they go on to sort of pick up the baton and investigate it a bit more.
So Sharon, would you say that looking at these reports, there are features that recur over and over?
Yes, what's fascinating is that although reports of near-death experiences have come from around the world, there do seem to be a number of common features. So one of the key features is an experience that is very hard to put into words. It's a very ineffable experience. There's often a very, a lot of people report being out of their body. They often hear themselves being declared dead. Some people experience a tunnel, which actually sometimes marks a boundary between one kind of existence and another. Some people have a very visual experience of a very beautiful landscape. Others report seeing deceased relatives or meeting people that they knew that had died. And of course, an interesting feature that we'll talk about later as well is that some of the observations are made of their environment. If they're out of their body looking down onto their situation, there are verifiable features that are another fascinating aspect of it.
And then another feature that I know sometimes gets discussed is this idea of a life review, where people feel like they're watching their actions back and sometimes somehow able to see the impact it had on others and that kind of thing.
Yes, absolutely. And some are given a being of light also is another feature. And this is an instance where people of different religious beliefs perhaps interpret that being according to their beliefs.
Right.
And there's often a very dramatic return to the body, sometimes chosen or sometimes a feeling of having been dragged back. Many don't want to return. But that's quite dramatic.
And often with that, a sense of being told that your time isn't yet, that sort of thing.
So a skeptic thinking about near-death experiences might say, well, they're just hearsay. That's just one person's opinion. It's their subjective experience, and these reports are anecdotal. What would you say to that?
Yeah, well, the thing that is quite striking about this phenomenon is that there has really been considerable rigor in the way that they've been recorded, because as you were saying, these experiences tend to happen in the context of a medical situation, and so the people who record the patient's immediate report of what they experienced and were able to sort of see what was going on with heart monitors and occasionally with brain monitors, these are medical professionals, and so there has been some quite rigorous documentation of NDEs and near-death experiences over the last few decades. So just to mention a couple of quite big studies that have been published in very respected medical journals. So Pim van Lommel's a Dutch heart specialist, published a big study in the medical journal, The Lancet, and where he had over 300 patients, and he didn't know before he included them in the study if they'd had a near-death experience. All he knew was that they'd had a cardiac arrest and been resuscitated. And so on that basis, he was able to get some really high quality data about kind of what proportion of them had some kind of NDE. And it was somewhere in the region of 60 out of that 300 or so who'd had some kind of near-death experience. And then Sam Pioneer, who's a cardiologist, a heart specialist as well, has done a similar type of study that was very rigorous as well. There's a dedicated journal actually that was set up to discussing the implications of this, the Journal of Near-Death Studies, and that's been going for a few decades now. And there's a handbook of the Handbook of Near-Death Experiences, which was edited by three leaders in the field who have expertise in relevant areas of medicine and psychology, and so that's really a helpful resource, kind of looking at the literature in a very broad way. And also there's a book that kind of tries to gather together as many cases as possible where, as you mentioned earlier, there's independent verification in some of these near-death experiences of what the person apparently saw when they felt that they were out of body, and people were independently able to verify that those events did in fact happen. So this book is called The Self Does Not Die, and it was put together by 3 Dutch researchers, and they've compiled dozens of cases like that. So yeah, it is quite striking that on the surface, it might be natural to assume that this is just kind of hearsay, rumor and so on, but actually it is really quite, the documentation is quite rigorous.
Yes, and that data has been collected since pretty much the 1970s, so now we have sort of over 50 years of data being collected on this phenomenon.
Indeed.
Yeah,
So if one were approaching this in a skeptical way, Sharon, and trying to sort of say, okay, people report these experiences, but nonetheless, we can try to explain these experiences in a way that is compatible with a materialist picture, where ultimately there is just brain activity. There's nothing supernatural, as it were, going on. How might someone try and explain these near-death experiences in that way?
Well, the first thing I want to mention is a fabrication. They might say that the person has simply made up the fact that they had an experience, and particularly since there's a lot of information out there on the internet about the kinds of things that people are reporting, it wouldn't be hard to make up an experience, perhaps for influence or a good book deal. And in fact, that did happen. I think there was an instance of someone that reported something that turned out to be false. And of course, this can't be ruled out. But I think that what's interesting about a number of cases is that they are recorded and reported by people who have nothing to gain by the fact that they've had a near-death experience and possibly have much to lose. So one such person could be the former Harvard neurosurgeon Eben Alexander. You know, in neurosurgery, physicalism is a very strong view. Again, the view that physics and chemistry or matter is all that there is, and if you don't have a functioning cortex, you cannot be conscious. And he himself actually held that view until he himself had a very severe bacterial meningitis and was in a coma for 7 days, and his entire cortex had shut down. And he did recover, although he wasn't expected to, and reported an extremely vivid conscious experience, and has since, you know, changed his view from being a physicalist or a materialist to being someone that believes there's more to us than just matter, to the detriment probably of or you know, to perhaps a loss of reputation in the field of surgery. And so why would you do that unless you believed that what had happened was actually very genuine? So I think that the argument of fabrication doesn't stack up in every case. There are some very fascinating cases.
As a general explanation, it doesn't seem to sort of cover enough of the cases.
No, exactly. The second critique is that it could just be residual brain activity. There's the view that, you know, when you're in cardiac arrest, obviously your brain is suffering from oxygen deprivation. And when you're suffering from that, the inhibitory cells in your brain are turned off, which means you get a surge in activity in some parts of the brain, particularly the visual cortex. And some skeptics might say that, well, this is what's causing the kind of the tunnel aspect of the experience. It's just a surge in activity in your visual cortex. And of course, we can't rule that out. But there's also the view that if it's lack of oxygen that's causing this phenomenon, then why doesn't every patient in cardiac arrest report a near-death experience? And secondly, even if it did partly explain the tunnel, it can't account for the ineffable visual experiences that the person has, and also the verifiable features of their experience that you mentioned earlier. And, you know, these are not the kinds of experiences you might expect of a brain in shutdown. If it's a brain that's gradually losing oxygen and in its last moments of life, why is the near-death experience so lucid and so clear?
So there's a disproportionality between the brain that's activity is being reduced very significantly, but conscious experience is being heightened.
Exactly. Yes, so we need to explain that disproportionality. And the final critique, it's not the only other critique, there are others, but is one of hallucination, that this is essentially the patient hallucinating. Now, the first thing to say there is you can only really have a hallucination when you have a functioning brain. And these patients are in a state of clinical death, medical clinical death, and therefore there is no functioning brain. And secondly, there are patients that have had both a near-death experience and have experienced hallucination, and they describe them as two very different things.
Yeah, yeah.
So I don't think the objection of hallucination really stacks up.
Mm-hmm.
So even if residual brain activity could explain a hallucination, there's also this interesting feature of near-death experiences where there are things that are observed in the real world during their experience. Can you give some examples of those?
Yeah, so obviously the cases that are going to be really interesting are where there's first-hand testimony from someone who was independently able to check what the patient alleged that they saw during their near-death experience. So yeah, there are dozens of cases like this that are recorded, and I mentioned that book, The Self Does Not Die, which has tried to compile a lot of those. So just to give two examples really. So there's one case where a woman in Toulouse in France was being operated on, and immediately she came round and told the anaesthetist that she had observed the whole of the operation from a perspective as if she was looking down from the ceiling. And then she reports that in her experience, she had felt herself moving across into the next operating theatre and observing what was going on in there. And it was that someone was having a leg amputated, and then the leg was placed in a plastic yellow bag. And so the anaesthetist was so intrigued by this, hearing this report right after the operation, that he went and checked what operation had happened in the next operating theatre, and it indeed was the amputation of a leg, and the leg had been put in a plastic yellow bag. Another example, so the director of an intensive care unit talked about a case where his patient, called Howard, had had a cardiac arrest and he'd had to be resuscitated, thankfully successfully. And when he came round, he immediately reported that he had had an experience where he'd felt himself floating outside of his body, going up through the ceiling into the floor above, and observing a large room with sort of beds all around it. And on those beds, he said there were patients hooked up to IVs, but he said they didn't somehow look quite human. They almost looked like dolls or something. And then he said in the middle was this workstation with computers. And the medic who gave this testimony about what the patient had reported said that at this point his jaw dropped, because in fact there was on the floor above the emergency room a nurse training station with beds all around the perimeter with mannequins hooked up to IVs. So this idea that they didn't look quite human. And in the middle was a workstation with computers. But he said, this was an area of the hospital hardly anyone ever went to except for nurses on training rotations. Sometimes patients would never go there, and the doctors wouldn't be talking about this during a resuscitation of a patient. So yeah, those are just two examples of dozens more cases like this.
That's really fascinating. And how would a skeptic respond to those? How would they attempt to make sense of them?
I think insofar as they were willing to grant the sincerity of the medical staff reporting these things, which I think they generally do, they would typically want to say that maybe it was some kind of information leakage, which is to say maybe the patient had just enough residual awareness, perhaps just enough residual hearing that they could hear what was going on in the room, and they could somehow build a mental picture, not in a really conscious, deliberate way, but sort of subconsciously. Or they could hear what the doctors were saying, the doctors and nurses were saying, and on that basis they could kind of build a mental picture. A little bit like if you've ever been asleep and a fire alarm's gone off and it somehow filters into your dream that the building's on fire. It's a little bit like that idea.
Yeah.
I think what I would say to that is, I mean, again, as you said with fabrication, maybe a few of the cases could be accounted for this way. It seems to me that the best cases don't seem to be that well explained in this way, and that's because the events in question are going on too far away from the ordinary senses of the patient, even if they did have enough residual brain activity. And the medics as well, were out of earshot or eyesight of the events that the person purported to witness.
Yes.
So I think particularly given the number of cases like this, I think cumulatively they point quite strongly away from a purely physicalist account of these experiences. So Sharon, these experiences involve some very unusual things, and you said earlier that there seems to be something ineffable about them. Do these experiences have a significant impact afterwards on the lives of the people who have them?
Yes, what's really interesting is that another key feature of a near-death experience is the transformational effect that it has on the person. And that's really interesting because although the near-death experience itself is hard for us to access, we can access the concrete impact that that experience has on the person. And if there's a concrete, real impact afterwards, that does suggest that something authentic happened in the experience itself. So a number of studies have been conducted to look at this. I could name any number of them. One of such is by the cardiologist Pim van Lommel in 2001, where he looked at 35 cardiac arrest patients that had had a near-death experience and compared them with 39 that hadn't. And they asked them about a number of features 2 years post the experience and 8 years post. And they observed significant differences between these two groups in social attributes, religious attitudes, and their attitude to death. So in terms of social attributes, the people had an increased capacity to kind of love other people, accept them, an increased kind of zest for life, a sense that life is really meaningful, an increased sense of purpose in their own life, which some also attributed spiritually or religiously according to their faith beliefs. And also their religious attitudes had changed significantly. They were much more aware of spiritual things, much more interested in investigating and pursuing spiritual things. And then also their attitude to death. There was a pronounced decrease in their fear of death and an increase in their conviction that there is life beyond death. And all of these things and more increase from the 2-year measurement to the 8-year measurement.
That's very interesting.
So that the impact of the transformation seems to be ongoing.
So just to pick up on something you were saying there about the change in their religious attitude. So I can imagine someone hearing about this phenomenon and thinking, well, I would expect that it was the religious people who are much more predisposed to have these. So someone who already believed in God and an afterlife would be much more likely to have a near-death experience than an atheist. But is that borne out by the data?
No, it's more neutral than that. People have had near-death experiences coming from a range of different belief positions. People from Eastern religions have had them, people from Judaism, Christianity, even atheists have had near-death experiences.
Yeah, there was an account about a notable Oxford atheist philosopher in the middle of the 20th century, A.J. Ayer, who had a near-death experience that he actually wrote about. And at the time, although I think he slightly went back on this later, he thought that he might have to rewrite his books and articles.
Yeah, it's fascinating that they seem to happen to people,
right,
whether or not they want them to or not, which again is a suggestion that it's something that sits beyond our preferences and our desires.
So, Sharon, if we try to step back a bit from the things we've been talking about and try to get some sense of what might the implications of near-death experiences be for that question about the relationship of the mind to the brain. And one thing that comes to mind in particular is that I suppose if even just one case of a near-death experience has occurred where there really was no brain activity, it it seems like even that one case would be a real problem for the view that the mind and the brain are just the same.
Yes, I think that even just one genuine experience such as these is enough to call physicalism into question. Because if we are just our brains, which is what a lot of people think, then when the brain dies, that ought to be the end of consciousness, and that ought to be 100% the case every time.
Right. No exceptions.
No exceptions. Physicalism has no way to make sense of near-death experiences if indeed they are genuine.
Yeah.
However, if there's more to this world than just the physical, and if God exists, then we live in a world that is both physical and non-physical. And therefore, even though we don't have all of our questions answered about them, we have a framework for making sense of them, because the death of the body and brain is not the end of human consciousness, it's not the end of human existence. And so actually the existence of God helps us make more sense of near-death experiences than if he doesn't exist. So that raises the question of how near-death experiences fit within notions of an afterlife, and particularly Christian notions of an afterlife. What would you say to that?
Yeah, well, I can imagine some people thinking that there's a tension there. And in fact, some theologians are not very big fans of near-death experiences and have tried actually to explain them away in the sorts of materialist, skeptical ways that we discussed earlier. And maybe that's because Christianity does focus on the idea of the eventual state in which humans enjoy an afterlife is one in which they have resurrected bodies. And so, yeah, on the face of it, I think you could think there's some kind of tension there, because maybe near-death experiences seem to be more a bit disembodied in nature. So I think, we're in very speculative territory here. I have a tentative thought about how actually they're not in as much tension as it might first appear, which is to say that there is a long-standing view in Christian theology that, if you like, there's life after death, and then there's life after death. So the eventual state will be one in which everyone has resurrected bodies, but in between then there's some kind of intermediate state of being a disembodied soul. And I think you could suppose that maybe near-death experiences are giving a glimpse into that intermediate state. But I think at the end of the day, and this is a point that the theologian Dale Allison makes really well, people who have these near-death experiences are quite clear that their reports of them, they're putting them into words, is so inadequate to capture what they experienced. And so I think we just need to be really careful about building very much on the specific details of these accounts. But I think what we can say at the end of the day is that they are broadly resonant with Christianity. And certainly I would suggest that there being near-death experiences in which there genuinely is something non-physical going on, perhaps in which the person's immaterial soul does temporarily leave their body. That is something that I think we would expect much more if Christianity were true than if physicalism were true, the view that everything ultimately bottoms out in physical stuff. So if we think about the present cultural moment that we inhabit, and the kinds of things that are trending and are catching people's attention when it comes to questions of meaning in life, spirituality, and so on. Do you think that the topic of near-death experiences has something to contribute to that conversation?
Yes, I think it does. I think that the backdrop to life is still materialism, the fact that matter can explain everything, that if you can't see and touch something, then it's not real.
Right.
But at the same time, some people are starting to question that. They're starting to ask, actually, can this view of the world make sense of everything that it means to be on this earth, to be in this universe, and to be a human being? And so actually near-death experiences are providing an instance within a clinical scientific context that there may be more to human beings than just their physical body. And if that's true, then that actually changes everything.
I mean, that's fascinating, because I think there is this really long-standing prevalent narrative in the West especially that basically says that as science progresses, as time goes on, the evidence for a materialistic view of the world is just getting stronger and stronger. It's all one-way traffic. But if what you're saying is right, potentially we've got an instance where an advance in science, a discovery and a set of data that's come to light really in the quite recent past might be pointing in the other direction.
Yes, absolutely. And there's even an instance from within the philosophical and scientific community of two people that took a bet on this. They bet each other a case of wine that, a neuroscientist, Christoph Koch, bet David Chalmers, philosopher, a case of wine, that if we just throw enough neuroscience at the problem of human consciousness for the next 25 years, we will have it cracked, and we will have solved the hard problem, the problem of why there is something that it is to be us.
That subjective inner feeling of, right.
Yeah, and how non-conscious neurons can give rise to the conscious self. If we just throw neuroscience at that, we will eventually have cracked it. And actually, kind of humorously, I think just last year at a conference, having allowed those 25 years to pass, the neuroscientist gave the philosopher a case of wine because they haven't cracked it. And that's not to denigrate the need for a neuroscience of human consciousness. We absolutely need that. But the view that science will solve it once and for all is not a scientific position. That's a philosophical position. But the science doesn't require you to hold that. This is actually, there are a number of different philosophies that could support that position. One of which is that God exists and there's a physical world with a non-physical dimension. Those two things together help us make sense of these things. And so I think that the existence of God is a really powerful framework for helping us make sense of near-death experiences.
Thank you, Sharon. Well, I think we've covered a lot of ground in this conversation, and thank you for joining us. I wonder if you'd ever heard about near-death experiences before this, perhaps whether you even know someone who's had a near-death experience. And wherever you're coming from on this topic, I hope you'll agree that it does raise some fascinating questions, not least the question of whether there might be more to the world than that which we can touch and see.